Hi guys, I hope you're all doing well. Today, me and my lab partner Jess are going to be discussing the adult physical condition of lymphedema. We'll go over the signs, symptoms, prognosis, treatment, and OT intervention, and I hope you enjoy. What is lymphedema? Lymphedema is the accumulation of lymph fluid inside the lymphatic system. It can affect extremities as well as internal structures of the body. It is mostly common in the extremities, but it can happen in other portions such as the stomach and in internal structures as well. There are many forms of lymphedema such as hyperthyroidism, which is one of the internal structures, but today we're mainly going to focus on the extremities. Before we talk about lymphedema, we first need to understand the lymphatic system. The lymphatic system is the body's internal immune system. It is composed of many different structures that fight off infection, and today we are going to talk about the lymphatic vessels, lymph nodes, the thymus, and the spleen, and the functions within the body. The lymphatic vessels are the highway network of the lymphatic system. It carries lymph fluid throughout the body, and the lymph fluid carries infection-fighting properties. The lymph nodes are the tiny ball-like structures attached to the lymph vessels that act as filters when lymph fluid crosses. It filters out the bad material such as pathogens so the body won't get infected. The thymus is one of the hormone-producing structures of the lymphatic system. It produces T and B cells which help fight off pathogens. The spleen is another structure within the lymphatic system. It produces hormones while also filtering out lymphatic fluid. Lymphedema can be caused by a variety of ways. It is caused by the blockage of the lymphatic vessels, which accumulate more lymph fluid. It could result as a result of obesity or by radiation and chemotherapy. There are many signs and symptoms to lymphedema. One of the most common signs is swelling of part or all of the extremity, including the phalanges. Other symptoms include a feeling of heaviness or tightness, restricted range of motion, aching and discomfort, recurrent infections, and hardening of the skin, which is also called fibrosis. With swelling of lymphedema, swelling can range from mild to severe, and there are many treatments that can be done to help reduce lymphedema swelling. There are many precautions when treating lymphedema. One of the most important precautions are preventing bacterial infections such as cellulitis, lymphangitis, and lymphangiosarcoma from infecting the body and from causing tissue decay due to skin breakdown. Along with infection precautions, those with severe lymphedema require fall precautions if weight limits mobility. To decrease the risk of infection, limit heat exposure. Heat can lead to perspiration, which can trap moisture and lead to an open wound infection if left untreated. By keeping the areas clean and dry, the risk of infection will decrease. If an individual is prone to chafing, specialized creams and talcum powder can decrease friction and limit the risk of other infections. OT treatments can also provide massage techniques to decrease swelling. But if a client has cancer or is prone to blood clots, consult the client's physician before treatment and confirm if the client is on blood thinners if there are risks for blood clots.
Manual lymphatic drainage is a common illness. Common contraindications of manual lymphatic drainage are acute congestive heart failure, acute renal failure, blood clots, infection, active bleeding, and undiagnosed cancer. Manual lymphatic drainage is a good option for treatment if none of these contraindications are present. Individuals with lymphedema may experience a change in their body image. They may not see themselves in a positive way due to their lymphedema. They may be embarrassed to go out in public or feel others will judge them if they do go out in public. This can lead to social isolation and occupational deprivation if left unresolved. The motor skills impacted are bending, walking, and enduring. Individuals with lymphedema may experience difficulty bending and affected extremity due to the swelling. This limits their range of motion as well as the functional tasks that they are able to do. Walking can be difficult as well. The added weight can cause an irregular gait pattern as well as pain and fatigue. Because of pain and fatigue, enduring through functional tasks and activities is more difficult. Here we have pictures of a woman with lymphedema walking. And as you can see in the photos D to F, she has to lean to her right to step forward with her left foot, which is her affected foot. And here we have a short video of an occupational therapist speaking on lymphedema treatment.
Feel okay, that pressure? Okay.
Kristen Damrell is an occupational therapist certified in lymphedema treatment.
Lymphedema can be anywhere in the body, so you see a lot of patients, breast cancer, lymphedema is clinically associated with
Complete decongestive therapy, or CDT, is a common treatment for lymphedema. It includes compression therapy, manual lymph drainage, skin care, and physical exercise under compression. Compression is used to decrease the amount of swelling in the affected extremity by using short stretch bandages in multiple layers. Lymphedema can also be surgically removed after weight loss. Occupational therapists work with the client to educate them about the condition and also to provide resources. These are links to both online and in-person support groups, information resources, and events that are both online and in person. You can find all of these links and resources on lymphedematreatmentact.org. And here are all of our references. Thank you so much for watching our presentation. I hope you have a great day.